Thanks so much for joining us. My name is Jennifer Wagner. I am the Director of Medicaid Eligibility Enrollment at the Center on Budget and Policy Priorities. Again, we appreciate you joining us for this webinar on improving benefits through human-centered design. This is part of our Emmy series, Elevating the Medicaid Enrollment Experience, where we really look at the different aspects of policy and operations and other things that affect how people access benefits. Throughout this webinar, we encourage you to submit comments or questions in the chat. We will definitely have some time at the end to address those and are eager to hear from you. So shockingly, this is a webinar on something other than unwinding the continuous coverage provision. Obviously, that has been the main focus of many of us for months or even years, as the case may be. And that will likely be the focus for many months to come. But as part of this Emmy project, we were eager to dive into things beyond just detailed policy information about applications, about renewals, about CMS guidance on unwinding. We wanted to touch on some other areas that really influence this body of work and can complement and expand our advocacy in this area. That was covered in things like user research, which we touched on last year, and how to really get the voices of people with lived experience and incorporate them into our advocacy. Today, we are very, very pleased to have our friends from Sevilla here to talk to you about human-centered design. Now, this is probably something you've heard thrown around before, and it sounds kind of cool, and it is, but you may not totally understand it. And so that's why we're eager to have them on board today to really walk through it. They're gonna help you learn what it is and also give some great examples of how it's been used in improving state processes, both in Medicaid and other public services. Sevilla has been at this for a while and has some great success stories to share. And then we'll talk also about how you might apply it in your advocacy. As I mentioned, this isn't directly related to unwinding policy, but it is something that is likely to come up over the next year or two as you work on this. It may come in different forms. There may be discussion about putting up an online renewal pathway to help with unwinding. There may be an effort to revise notices that go out as a continuous coverage provision ends. There may also be opportunities in your own work. I know many of you are doing great work on the ground and with community partners to get the word out, to get messages out about unwinding, what needs to be done, updating your addresses, completing renewals. And there's an aspect for this human-centered design concept to be applied throughout all of that. There's also a chance there may not be bandwidth for a big effort around human-centered design with everything else going on. And that's okay too, but we really want you to kind of better understand this valuable tool and be ready to use it in case the opportunity arises. So again, please submit questions and comments. We'll get to those later on in the presentation. But with that, I am pleased to turn it over to our friends from Sevilla.
Thanks, Jen. We really are, pleased and honored to be here joining all of you. We've been following along with this work for over a year now that it's been going. So thank you for having us. We'll do some quick introductions to the three of us who are here, and then we'll step into some of the content that we have prepared for today. My name is Lena Selzer. I'm a co-founder here at Sevilla, and I've been a big part of shaping our research and design practice here at the studio. So I've done a lot of work in partnership with leaders and institutions to simplify and streamline their services to make them easier for folks to access. We'll talk more about that work in a minute, but I want to kick it over to two of my colleagues, Gabby and Kristen, who will each introduce themselves too.
Hi everyone, I'm Gabby Durantes. I'm one of the design leads here at Sevilla, and I've had the opportunity to work on a lot of our health and human services work around applications, renewals, and correspondence, to name a few. I'm just very excited to be here with you all today.
And I'm Kristen Ureta. I've been working closely with Gabby as well on health and human service work in Michigan, Missouri, and Washington. And I also do some of the graphic design work for our applications, forms, and renewals.
Amazing. So we are going to share a presentation that we prepared. Our hope is that this can be a bit of an interactive session. So we're going to spend about 30 or 40 minutes walking through some content that we have prepared, and then we'll open it up for questions. Like Jen mentioned, please, as we're going, add questions to the chat, and we'll have time at the end to go through them. And so just a quick agenda for today. We're going to do some high-level introductions just to Sevilla and the work that we do, since it's relevant to some of the stories that we'll be sharing today. We'll then talk about human-centered design our sense is that most of you are aware of what human-centered design is and have heard of, at least been exposed to it in some way before. So we're going to only spend 3 or 4 slides talking about how we view it at Sevilla, since it's a pretty wide category of work and can be viewed in different ways depending on how you approach it. And then we'll spend the majority of our time actually talking through examples and case studies of how this work is how human-centered design is being used really specifically to improve access to public benefits in health and human services through the work that we've done in Michigan, as well as now Missouri and Washington State as well. And from that, we'll be able to step into a more specific conversation about, if this is work that feels relevant to your work or that you see intersections for in your state or county or jurisdiction, how can you get started? What are some good next steps that you can take, as well as some future learning, some opportunities to step into deeper learning on this if it's something that you're interested in. So that's what we'll talk about today. I'm going to do a quick introduction just to the organization. Obviously, you've met 3 of us here on the call, but I wanted to shine a light on some of the others who aren't here today, but are really important parts of this work behind the scenes. So we are a nonprofit design studio that is based in Detroit, Michigan. We're a fairly small team. We're a team of about 16 folks right now. We'll likely grow to about 20 by the end of the year. And we come from a myriad of different backgrounds, but our deep keel is in human-centered design. And so we use that process to partner with leaders and practitioners and institutions to help them simplify and improve access to their services. And a big part of that work has been really focused on health and human services over the last 7 or so years. And so we want to talk a little bit more about that work today. Before we do that, though, we do want to ground the group in just some high level overview of human-centered design. What is it? How do we view the process so that everyone's doing it in one specific way as we go through these stories. And then as we step through the case studies, you'll see how this process is plays out in the real world, more specifically in the work that we do. So I'm going to kick it over to Gabby for now.
Yeah, so we found that this photo is the easiest description of the work that we do at Sevilla. We call it the person on the path. Human-centered design work requires you to adopt a design mindset. And this is different from an institutional mindset, which believes that it has all the information it needs to answer a question and centers on the objectives and assumptions of a system versus seeking to understand through the individual people that are closest to the problem. So the human-centered design mindset, by contrast, is constantly asking questions. It navigates uncertainty by seeking out stories, specifically from the people closest to the problem it's engaging with, who we refer to as the users. In practice, what that means is spending a lot of time side by side with residents and community members to understand their needs and integrate their perspectives at every point of the project. At Sevilla, a human-centered design project will usually consist of 4 phases. We start off with phase 1, where we conduct research. We really want to understand user needs through the research and best practices. In phase 2, armed with that information on the problem from a user's perspective, we start to design solutions that meet user needs, and we take them back out to users for feedback. In phase 3, once we're ready for a pilot, we will have iterated on designs that are working well during feedback sessions, and then we test them out in the real world and measure outcomes on a small scale before we determine that they're ready for a rollout. And phase 4 implementation, after a successful pilot, we'll work with the organization that is going to be implementing these changes to create readiness so the new designs can be launched at scale and everyone's on board. We have a couple of case studies to share on those, and so I'll pass it over to Lena to talk about our first one.
Yeah, so that's a high-level view of how we view the process. As Gabby mentioned, starting first with research, stepping into design and testing, then eventually piloting and implementing. We want to walk you into 4 examples of how this is played out in the real world in health and human services, starting with the work that we began with in Michigan. So the first piece that we want to step into is related to applications. These are applications for public benefit programs in, every state has them. But when we first started in Michigan, this was actually a picture of that application, the photo on the right. At the time, the application for public benefits was the longest application in America. It was over 42 pages long. It asked over 1,000 questions of clients or residents, and it had over 18,000 words, which we came to find later was longer than Shakespeare's Macbeth. So this is a really clear and good example actually of something that, as Gabby was mentioning, was not designed around the person on the path. It was not designed around the resident who had to fill it out or the caseworker who had to process it. It was really clearly designed around, you know, the policies that underpin the program, the, you know, lawsuits that came down over the years, audit findings that surfaced over time. And, you know, it was not that there was ever a moment where they wanted to create a really big pain point for residents to fill out. But it accumulated over the course of about 30 years to a point where this is what we had, 2.5 million residents filling out every time they needed to access a public service. And the reason why we started here is that we came to feel that applications are a really important, what we call key domino. They're a really important piece to think about in a redesign, because they're essentially the front door for all services. Like if you don't fill out that application, you're not even going to have a chance at accessing the benefits that you're eligible for. And so it became a really important piece to start to think about and focus on in the redesign. So what redesign looked like using a human-centered process looked a lot like this. It meant spending hundreds of hours sitting side by side with residents in the state of Michigan and with caseworkers who process these applications day in and day out to really better understand what was their experience like trying to navigate the system, what were the pain points that they were facing again and again, and ultimately what did they imagine would create a much better tool for them and better meet their needs. And so in 2015, we started down this path with residents and caseworkers in the state of Michigan. At the time, we actually didn't have a formal relationship with the state. This was just something that we as a studio saw as a really big pain point in Michigan and across the country and wanted to start to make progress on. And over the course of the project, started to engage the state more formally by sharing our research findings and building the case for why change was important. And so by the end of our initial research phase, we had developed not only insights around what the needs really were for residents and caseworkers, but ultimately a prototype for what could be a solution moving forward that would much better meet their needs, that had been designed kind of side by side with caseworkers and residents. And so the state leadership over the course of many months in conversation agreed that this would make sense to move forward with. And the ask for them was to pilot that at a small scale. So like Gabby walked through the process, we'd gone through the research, we'd gone through design and testing, but we knew we wanted to test it on a small scale before scaling it much wider. And that was also important to help them make the case that, you know, the outcomes were what we hoped that they would be. And so the very next thing that we faced was building support within the organization. And so one way that we did that was actually through immersive activities with leaders in the state of Michigan, where we brought executive leadership into Sevilla. We had turned Sevilla into the studio into a health and human services office. We had, you know, a bunch of chairs lined up. We had people sitting in the chairs filling out applications. We had noise going as if that we had recorded actually in a live office. And when they came off the elevator, we greeted them, shook their hands, welcomed them to the DHS office at Sevilla, asked them to take a seat, handed them the application and said, if you could fill this out, that would be great. And we just stopped talking. We gave them 15 minutes to navigate that application. For 3 of the 4 leaders at the time, it was the first time they had ever seen the form that up close. And we don't say that with criticism. It's just, you know, when leaders are working at that level, they have a lot of responsibilities. They have a lot of things that need attention. And so they sometimes aren't aware of the things that are actually creating the most pain day to day for the folks who are closest to these issues. And after going through that experience, they really were supportive of moving forward with the redesign and with the pilot. And so together we started to link arms in a more formal partnership. And then we're met with the very next challenge, which was the policy and legal requirements that had to be met in order for us to be able to test that new and redesigned application with even one real person in an office. This is a picture of the policy manual for benefits in the state of Michigan. It's over 1,700 pages. And it basically outlines the policies for Medicaid, food assistance, cash assistance, childcare, and state emergency relief. And at this point, this is where a lot of human-centered design projects start to crumble, right? So it's fairly common to go out, do research, come back with ideas on how things could be better, but the rubber really meets the road when it comes to the institutional constraints. And I know these are things that you all face every single day. And so the question really became, can we actually keep this short, streamlined prototype of an application and pass it through 1,700 pages of policy requirements and have it come out the other side short, simple, and relevant for folks while still meeting all the federal, state, and departmental policy requirements. So that required about 6 months of integrative policy work across the 5 core programs at the state level in order to come to an agreement among those teams on what information was shared across their programs, what information was distinct and had to be asked only of people who are applying for one or more programs, and what was the information that absolutely had to be on the application versus information that could be collected or was better suited to be collected in an interview or through other means if that was part of the program design. So after about 6 months of work on that, we did come to alignment with the teams and ultimately had a streamlined application that was 80% shorter than the original and met all of the requirements, and also got sign off from FNS and CMS to proceed with a pilot. And so from there, a really important phase of the project kicked off, which was bringing that work into real offices. We piloted on a small scale by choosing 2 offices in the state of Michigan that were pretty distinct from one another. One was a very busy office that was located near Detroit. It was a complex office. There were over 40 languages spoken in a 2-mile radius. Really, they had very large family sizes that tended to come through that office. And so we knew that the complexity there was very real. And if we could get it to work in that space, we really, believe we could have it work anywhere. In addition, there's a lot of parts of Michigan that are quite rural and not urban centers. And so we also intentionally piloted in a location that was more reflective of a rural community. So we chose a community outside of Lansing that was a smaller, quieter office, more homogeneous, and wanted to really just make sure that between the 2 pilot locations that kind of anyone in the state could see themselves in that picture. And so piloting was really helpful both in gathering feedback from end users, so from clients who were filling out the application and from frontline staff on what was working and not working and making improvements in real time. But also it allowed us to do a lot of quantitative data collection. And this was a really critical piece in helping to ultimately make the case for change, because we found that, for leaders to invest in these types of significant improvements, they need to be able to turn around to their executive leadership or the legislature or others and really make the case for why the investment is worthwhile. And they need both qualitative stories and quantitative data combined in order to make that case. So the pilot became really critical in providing that confidence for the leadership who are supporting this project. And ultimately, the pilot was really successful and led to confidence from statewide leadership to roll this out much more widely across the state. And so what that meant in Michigan was that there were over 100 offices with over 5,000 staff that needed to be brought on board to this work in order to support it. In addition, as you all know, there's just dozens of different stakeholders that tie into these systems. There's advocacy groups like you, there are unions, there's a legislature, there's other state agencies that tie in, there's complexity just within the agency itself. And so we really work to bring human-centered design all the way through the process. So not just at the beginning in the research or in the design phase, but actually all the way through how things got implemented. So this is a picture of a lot of the staff during the training program that we designed, and it was very intentionally designed to make sure that the caseworkers actually were front and center in the process of training their peers. So we had caseworkers from the pilot offices who had tested the application deliver training to their own peers in order to really represent in a very firsthand way. This is what you should experience. This is what this is what I had trouble with. This is what really works about it. And I would really encourage you to give it a try, because this is ultimately what you'll see at the end. And that just came with a lot more credibility than if, the directions were coming from on high in Lansing. And so it's a really amazing moment of the project where it really left our hands and started to be picked up and owned by caseworkers from across the state, who really took a lot of pride in seeing their fingerprints all over the final product. And we brought a similar intention to the stakeholder engagement effort ultimately. So in the end, this is a picture of the assistance application that came from this project, just the front page, but we really worked to integrate and bring the 5 core programs: healthcare, food assistance, cash, childcare, and state emergency relief into one single point of entry, whereas previously they'd been distributed across 4 different applications. We restructured the application to have a core application that contained information that people would have to fill out regardless of what program they were applying for, and then specific supplemental pages for the programs that they'd only had to fill out if they were applying for that specific program. And each element of the design ultimately received dozens of hours of user testing and feedback, everything from how the page was structured to the way the language was worded to the colors that were used. And so clients and caseworkers really gave a lot of input on designing something that ultimately worked well for them. And the really exciting thing about this is that not only were we able to measure in the data that was collected through the pilot the impact it was having, but we also just started to hear a lot of firsthand stories from folks about what an impact it made in their lives. This is just one quote, but after filling out the new application, I feel like I can breathe again. And so again, just a small example, but we were just hearing a lot of firsthand accounts of, what a meaningful difference this made for folks, not just in the amount of time it took them, but ultimately how it made them feel and how it felt they were treated, to have something that was designed so thoughtfully and in a way that considered their needs. So in the end, the impact was really significant. Ultimately, we were able to streamline the application by 80%. For residents, about 90% of people were able to fill it out in less than 20 minutes, 40% in less than 10 minutes, depending on how many programs they were filling it out for. And not only was it way better for residents, but ultimately was a lot more effective for staff as well. Applications started to come in 96% complete, which was a big improvement over the old application where a lot of sections were left blank. And that meant that they didn't have to spend extra time, chasing down information, filling out blanks, trying to clarify things. They spent 60% less time correcting errors on applications because folks, understood what was being asked of them and could provide that information correctly. And ultimately, the time that it took to process those applications decreased by almost 50%. So that was a huge impact when, we considered the 2.5 million applications that come in every year. So this data was really significant in helping the leadership in the state of Michigan see that using human-centered design to redesign core elements of their process not only would make things better for residents, but ultimately would impact their staff and their organizations as well. So from there, the question became, how do we use this process to impact other parts of the benefits delivery experience, knowing that it was really significant to redesign the application, but there's, as you all know, many more parts of the process that are still cumbersome and hard to get through and end up being stumbling blocks for folks who are trying to access services. So we're going to walk you through a few other examples of how piece by piece we've started to take that work and redesign other elements of the experience to improve. Ultimately, what is the goal is to improve kind of that full user experience from end to end. So I'm going to kick it over to Gabby, who will talk about renewals.
Yeah, thanks, Lena. So as we were learning about the application, we quickly started hearing about renewals. It was easier for people to apply now, but unfortunately, some of them would end up experiencing a loss or a break in benefits because of the paperwork again. So building on learnings from the redesigned application, we worked again with caseworkers and applicants to reimagine the forms that Michiganders use to renew their benefits. As you can see on the left-hand side is a photo of the old renewals, which share many characteristics of the old application for benefits. There's institutional language, design that's created a significant burden for both clients and caseworkers. We've heard this font being described as teeny tiny. The forms created confusion and sometimes even even created a lots of benefits for clients, like I mentioned before. So what we did was work really closely with end users to redesign them to be what you see on the right-hand side. And so on the redesign, there's a lot of different elements that I could point out, but I'll just talk about 3 of them. The form is more simplified and intuitive. It uses plain language and bold boxes that call attention to the most important information. One of the things that we heard during our interviews is that there's so much paperwork that residents are receiving that it's hard for them to know what's important and what's not. In this case, a renewal is very critical so that they can continue to receive their benefits, but it was hard for them to know that this paperwork they were getting was even a renewal. So what we did is we minimized the name of the official paperwork, which is the redetermination, and what we made really bold and at the top was the renew your benefits. So we had heard over and over that the action wasn't clear that they needed to take. And so by making the action just the very first thing that they see is almost the title of the letter, it made a huge difference. They knew immediately that this was the renewal paperwork and that they needed to get working on it. The second thing was the date that the renewal needed to be submitted. That was something that was really hidden as well and often got confused with the interview time. As you see on the left-hand side, it didn't really make sense. It would say that the interview date was the same date that the paperwork was due, but oftentimes residents were holding on to the piece of paper. They'd call their caseworker or be waiting for the interview, and the caseworker would let them know that they could not process the paperwork because they had not received it. And so what we did in the redesign on the right-hand side, you'll see in that big, bold black box that it says the due date on there. It's clearly very visible. It's the second thing that residents are seeing after the header. The third thing that we heard from clients was that it shouldn't be rocket science to renew your benefits. Someone literally said this should be as easy as 1, 2, 3. And so what you'll see in the redesign form are the 3 steps that need to be taken so that clients can maintain their benefits. We kept it really short and simple so that they knew what they had to do and that they would be able to just submit that right away. We received a lot of positive feedback from both clients and frontline staff. This was just a quote that represents a lot of what we heard. I like this form. It's bold, modern, straight to the point. I understood it and filled it out in 5 minutes. Now I can move on with my day. The impact more widely of the redesigned renewals is that they were, again, these numbers will sound familiar because they were very similar actually to the application, where they were coming in 96 more complete as well. They have 60% fewer errors, which means that caseworkers are processing it in much more quickly. 50% fewer lobby visits. One of the things that was really striking to us as we were in the lobbies is that people were often coming into the lobby because they had questions on their renewals or because it was the very last day they could turn it in. And so they saw a significant decrease in lobby visits once the new forms launched because people understood them. They weren't waiting until the last minute to mail them in, and they were coming into the offices on time. And there was also a 15% increase in approvals. And this is because people understood the questions they were being asked and they were filling out the paperwork correctly. There were no administrative errors that were being filled in on the form. So after working on the renewal letters, the team moved to tackle correspondence. And I'll pass it over to Kristen to share more about that.
Thank you, Gabby. And yeah, continuing to build on learnings from the redesign application and renewals. For our next step, we worked with frontline staff and residents again across Michigan to reimagine letters that clients received from MDHHS about the benefits. And we focused on 15 letters that residents and staff said were the most confusing. So like the old application and renewals, the correspondence letters also contained a lot of complex institutional language and designs that created confusion for clients and just generated a lot of phone calls for staff. And so working on a range of letters that are either purely informational to case action notices and verification requests, the new correspondence letters are streamlined to be short, simple, and relevant, quickly communicating what the letter is about and what the client needs to do while still meeting policy and legal needs. They also provide clear steps for how to take action or information in plain language, which lowers the barriers for clients to take action if they're called to, or comprehending what is said. So as you'll notice in this example, this is a state emergency relief decision notice. It pulls on a lot of design elements from the renewals. And we've just streamlined it to be a lot easier to comprehend, a lot more white space, friendlier language, and just more structured and organized information for the client to easily skim and read through. And this is a quote from a caseworker that shared their thoughts about the notices that we were sharing with them, and said, the updated notices will mean increased efficiency, less headaches, less phone calls, and fewer hearings, all while providing better customer service.
Yeah, so we've been talking a lot about the touch points that folks have to interact with on paper, but as many of you probably interact with in your states and locales, online is a really critical piece as well, and increasingly so through the pandemic, since folks are really incentivized to want to manage and their benefits from home and not have to go into a public place if it's not necessary. And so the question became, as we were starting the redesign in Michigan on the renewals and on the application, how do we bring a similar level of rigor to the online experience that we have on paper in order to make sure that no matter what touch point or no matter what channel folks are coming into the department through, they're having a consistent and user-friendly experience. And so at the time, there were about 50% of people applying on paper and 50% online. I think the numbers are now higher for online, but the online system carried a lot of really significant challenges for folks at the time. The online portal that people in Michigan use to access benefits is called MyBridges. And at the time, it was really cumbersome and hard to navigate. It was not designed to be compatible with mobile phones. People were often getting into the application, pressing the back button, and it was starting them all over again, or it was crashing. They're having to start from the beginning. And so it was really not a very reliable source for folks. And the question became, how do we use a similar process of human-centered design to redesign this and make it a lot easier for folks to access through their phones? And so the process for human-centered design looked fairly similar in designing for the online platform, but there's a few key differences that I would want to call out. One is in the photo on the left, you will see that once we reached the research and testing phase, instead of designing prototypes on paper like we had for the application and renewals, prototypes started to be digital. And so what that meant was creating high resolution mock-ups for what the application would look and feel like. And ultimately putting that on, having folks access that through the phone that they use. And we would sit side by side in user testing sessions in order to watch them navigate and click through the screens to better understand what was working, what was not, and how could it be improved. This is before anything was coded. So that's a really critical difference, which is that in a lot of states right now, there's a lot of feedback that's given at the beginning of the process in a research or requirements gathering phase, and then through UAT testing at the very end once everything's been built. But this was actually a new process for the state of creating design cycles before things were coded in order to test what the designs would, how they would work, and make improvements before things went into development. We listen really intently to what people have to say, as you can see on the photo in the middle. And then a photo on the right is just a picture of the type of feedback that comes from user testing. So on the board, you can see each screen that was ultimately tested. And then each Post-it note is a piece of feedback that was received from, this was just one day of testing. I think we tested with 3 or 4 different folks that day. And you'll just see there's feedback on every element of the design. There end up being dozens of pieces of feedback on every screen. And this is the type of feedback that's really helpful to incorporate into designs before things are coded, because ultimately it ends up working a lot better. It's a lot easier to make changes before things are coded. And it's ultimately less expensive because you're designing something that works from the very beginning. So that was the process that ultimately we used and ultimately designed a new version of the MyBridges portal. The thing that was really critical here was that it wasn't just an online application or an online renewal platform, but it was really a full suite of tools that enabled people to manage their case from end to end, no matter what type of action they needed to take. So folks were able to apply easily and quickly online. They're able to renew their benefits for the 5 core programs. They're able to upload documents. They're able to view their letters. They were able to report changes through the portal. They were able to even look up, thousands of community resources that were available outside of the state that might have been relevant in their local area based on their needs. And so it really created a one-stop shop for folks to be able to manage kind of the full life cycle of their case. This all went in before COVID, but we've just seen since COVID how critical it's become in really empowering people to manage their benefits while in the safety of their home or wherever they are, without having to unnecessarily expose themselves by going into public places or chasing down caseworkers in local offices to try to get help. And so we've heard things like, I feel a lot more comfortable using the new site. It guides you through step by step. It's a lot less intimidating. And ultimately, the impact has been really significant as well. There's nearly 3 million folks who access this portal every year, and 4,000 community organizations outside of the state who also tie into it. We've seen the time to apply online decrease by 50%. Text messaging has been a big capability that's been built in here. So there's been over 500,000 text message reminders that are sent out at key junctures to help people manage their case and take important actions. And then the number of documents submitted online has skyrocketed from the beginning to now over 6 million documents that have been submitted to date. So it's been really exciting to see the uptake on this and to realize there's actually more demand for online services than there was originally. But it really required creating something that was user-friendly to get folks to trust this channel and to want to use this channel, compared to kind of the safety blanket of going into an office and like physically giving the documents to someone or that type of thing. So we've been talking a lot about the examples. This is the work that, we do in Health and Human Services to bring human-centered design into creating simpler and easier benefits access. But I think we are where all of you are on your own, missions as well. And for those of you who are listening to this saying, how do I get started? How do I bring human-centered design more into the work that I do, or that how do I advocate better for it at the state level? We wanted to just share a few thoughts on how you might get started. One thing that we would say is that while there's a lot of opportunities to improve these systems, like from the original research we've done, there's a journey map that's over 100 feet long of the experience of trying to navigate public benefits in Michigan. And there's hundreds of things we could have redesigned on that journey map, but ultimately what we have found is that there are certain things that ultimately have a greater impact than others. There are things that we call key dominoes, where if we redesign them, it has kind of a disproportionate impact on the experience for residents and for staff. So the 4 that we would really lift up here, at least based on what we've shared, are lifted up from the case studies, but application redesigns, renewal redesigns, notice redesigns, and online portal redesigns have a huge impact on improving the user experience. And we have really learned through the work that we've done in partnership with states that they rarely have the ability to tackle these all at once, even within one category, like on notice redesigns. Like Kristen mentioned, like there's hundreds of notices we could have redesigned, but they just can't take on that much all at once. Things don't move that way in state agencies. And so the question really becomes, how do we narrow the focus and get started with one key piece, knowing that if we're successful in that one key piece, we can continue to build the momentum. And so we'd encourage you all to reflect on, given the work that you do and the context that you're in, what is a key domino, whether it's one of these 4 or something separate, that you could really kind of hang your hat on to start and really work to make progress on prior to going wider. So yeah, that's one thing that we would encourage reflection on, is identifying what's the key domino for you. Once you have a key domino or a thing that you feel really strongly about, there's a few steps that we would recommend thinking about when you're starting to approach a redesign project. The first is to conduct initial research with end users to root the case and the stories and needs of real people. So, from this work, especially if you've been in the field for a long time, it might be very obvious to you what the problem is and what needs to get solved, and you might have a ton of data to back it up. But even in those cases, rooting that work in the story of 1 or 2 real people can really help bring things down to earth for leaders who are often at 10,000 feet. But once we bring them back to like ground level, it can really help make the case for why things need to change and why they're not working for folks on the ground today. after rooting that kind of case in initial research, another thing that we found to be really helpful in bridging relationships with leaders who will, and making the case for change, is ultimately to create what we call a proof of concept or a prototype that helps leaders see what is possible. So it's the difference between showing up and saying, you know, this is what really needs to change, versus this is what needs to change, and here's an example of what it could look like. That one additional step really helps pull the imagination of leaders and helps you show up as like a partner that's willing to link arms with them in order to go, to go on that walk. And so that might be something that you feel confident that you can help create, or it might be something that you need to partner with a designer from your organization or externally as a contractor to help you create. But where you can, create these examples before showing up to make the case, it can really help pull people in with you. The third thing we'd say, and this probably feels obvious to you all, but it's just so critical to engage executive leadership in these projects. And we have found that, you know, at that level, they're just drinking from the fire hose all the time, especially these days. Like, they have 1,000 things on their plates and 1,000 things on their to-do list, and everything is urgent. And so if you can engage them in an immersive experience that helps them personally connect to the work that you're trying to do and helps to move hearts and minds, that can be really helpful. We told an example about this in the application story of, you know, rather than just having the meeting with the state officials where we walk them into the work that we were, the things that we were hearing and learning and the work that we believed was important, you know, taking the time to actually have them sit down and fill out that application themselves before getting into that conversation. And it really just shifted the entire nature of the relationship from there on out, because all of a sudden they were seeing these problems in a new way, even though they'd looked at it, you know, a million times before. So that's one additional thing that we would recommend. And then once you are in a conversation with leadership in agencies about going and redesigning an element of the experience, really working to assess the readiness of the team. So there's many aspects, obviously, of this that need to be in place for them to be successful. Everything from their capacity to conduct research, design work, to integrate policy requirements, to navigate the technical requirements, and ultimately navigate the implementation. And so we'll talk a little bit more about this, but we have a guide that we've prepared in partnership with Sarah, who's actually on the call today at the Beck Center, on how you can assess the readiness of the team in partnership with state agencies. And then, from there, presenting a roadmap for what next steps could look like can really help you show up as a partner and help them see how it might be possible. So we're running a little short on time, so I'll blow through this quickly, but wanted to lift up, for those of you who are, you do have a key domino in mind, and there is a burning question of like, how do I prepare for human-centered redesign? We've created a guide in partnership with the Beck Center that goes into many of these recommendations in a lot more depth. We can send it to you, or have Jen and the team send it to you after this session. We'd really recommend taking a look at it. It both lays out recommendations for if you're going to take on a kind of a large scale redesign project like one of the ones we just walked through, as well as recommendations for, if you have a smaller project that you're working on, like improving a single notice or just adding more plain language, what are the opportunities to do that within the scope of what's feasible for you. With that, I'll kick it over to Kristen, who will just talk a little bit more about if this is something that's of interest to you and an area of work that you want to go deeper into, how can you learn more, and some resources that are available to you after this session.
Yeah, so as much as we really, really love the work that we do, we know that we can't do it alone, one state at a time. So we created Practica, which is a collection of online courses designed for staff, leaders, and advocates who want to build institutions that put humans first. So if you go to our website under the Learn tab, you'll be able to access more information about the Practica courses. Currently, you can find courses on foundations, which are an introduction to human-centered redesign, design principles, sharing best practices in visual and content design. And coming soon will be courses on applications, renewals, correspondence, as well as user research. And so these are free online courses meant to help you get your redesign effort off the ground. They'll guide you and walk you through developing and kicking off your project, equip you with tangible skills in design and user research, and then impart lessons learned from Sevilla's work in Michigan and Missouri. Yeah, we're really super excited about where Practica has landed and the feedback that we've been getting from our current learners. It's only been live for just a few months, but there's already over 70 learners across the states that you can see highlighted on this map. And it even has reached Canada and Europe, so that's really exciting for us. And yeah, like Lena said, if you're interested in signing up or learning more about Practica, you can join us at sevilla.org, Practica. And while you're at the site, you can also sign up for our newsletter where we share more stories about the work that we do and just celebrate institutions, leaders, and change makers who are working on small to big acts of change as well. And yeah, we hope you'll join us.
Thanks, Kristen. I'll stop sharing now. Yeah, we would love to open up the rest of this time just for Q&A and discussion to make sure that we're addressing the things that are most pressing for you all.
Awesome. Thank you so much. So we did have a few questions come in the chat during the presentation that I know you might have touched on a little bit in the presentation, but maybe we could make sure that we get those answered. So the first few were kind of around your process for developing plain language, and then specifically around notices and applications in languages other than English. So if you could talk through a little bit your process for developing that language and how that kind of worked across different languages as well.
This is a great question. Gabby, maybe I start and then kick it over to you. Okay. Yeah, the process for plain language writing, I think, is really important and an interesting one to consider. There are best practices that are really helpful and important in grounding the work. So many of those are, like Kristen was mentioning, one of the courses on Practica is actually on, just visual and content design. What are best practices, both in general, but then also in public services. What we will also say, though, is that there's nothing better or more telling than what actually works for people. And so while best practices are good to follow, it does not replace the need to do user research and user testing with real people in community in order to understand what are the words that they use, how do they understand a sentence as it's designed. For caseworkers, when they get calls from confused clients, how do they describe it to them? And so we've spent really dozens and dozens of hours listening to community members describe, this is how I understand this to be, and listening to caseworkers describe, this is how I explain it, and then working to channel their voices into the words on the page. So I guess I would say the approach is twofold. One is ground yourself in best practices. There's a lot of resources out there to help with that. But two, do not skip over the user research and user testing, and really make sure that you're listening to the voices of people who are closest to it and channeling those words in the notices that you're designing. Gabby, I know we've done a lot of work also in the translation piece. Do you want to speak to that a bit?
Yeah, so we were able to translate the forms in Michigan into Spanish and Arabic, which are two of the other primary languages spoken here. One of the things that we learned is that it's really important, again, to user test that language, because even though we're translating simple English language into simple, like, for example, Spanish language, there's regional differences and different types of Spanish that are spoken. And so trying to understand what was common here in Michigan, and also wanting to make sure that the translation is done almost more like a literary translation, like you would translate a book instead of just a form, because there's certain things that just don't translate as well. And so one of the things that have made the application, renewals, and correspondence easier for people is the tone that they take as well. They feel a little bit friendly, and they're not interrogating you, and getting the right tone, even if it's like a simpler word in another language, can be quite challenging. So you need to be working really closely with native speakers. For our Arabic translations, we work closely with one of the community agencies here in Michigan called Access, and worked with translators and residents that would be applying to really understand the nuances and making sure that we had the right translators helping us get the forms to have the same tone and feel as the ones in English and Spanish.
Great, thank you. And I did actually used to work at Access before I joined the center, and it was always great to see the work that Sevilla did. Yeah, really cool connection there. So we have another question more about engaging folks in the process. So how did you recruit and engage residents to participate in this process, and what does their participation look like?
Yeah, Gabby and Kristen, you two want to talk about that both with community orgs and online?
Yeah, community orgs. Yeah, so like we mentioned, AXA is one of the many community partners that we work closely here in Michigan. One of the things that we've found is really helpful is to partner with organizations in the community who are already serving a lot of the clients that would be applying for benefits or that are applying for benefits, because just kind of trying to connect with someone without having like a common connection can be a little bit difficult. And so for our in-person interviews, working with community partners has allowed us to, I guess, borrow some of the trust that the community agencies have built with residents. So we work very closely with organizations that provide access to food, shelter, and other services in the community. We'll just provide them with a brief description of the work that we're trying to do, give them a sense of what the conversation will look like, and then they share out with some of their clients. And yeah, that's how we source a lot of our in-person interviews. And then I'll let Kristen talk about the online ones.
Yeah, so with the pandemic, we did have to change a lot of our approaches when it came to user interviews, and we were able to find this online service or platform called User Interviews, where we were able to recruit residents within anywhere across the state to partake in any interviews or testing. And it's a really great platform, and there's others like it where you can set very specific parameters, like I would like to talk to people within this certain area of the state or with this income range or this demographic. And it's been really helpful connecting us with people that we wouldn't have normally been able to meet, especially with the pandemic. The only caveat with it is that you can't rely on it completely as its main source or the only source for recruiting users because of the technology that's required to be able to use it. So it's been a really helpful tool to supplement the partnerships that we have with our community organizations and people who we can meet through there. But it's not our only avenue that we're using for recruiting.
Great. We have a question more about like data usage and privacy. So the question is, what are the data produced by this online portal and app? And how did you think through data usage or privacy communicated to users in simple language?
I'm not sure if I'm not answering this question correctly, then correct me. But yeah, so the online portal is run through the state. And so the information that's collected through it is the information that people are supplying in order to apply or renew their benefits or report changes. So they're putting in their personal information into that system in order to submit an application to the state, and that's then getting transmitted to the back end. It's a really good question around data use and privacy. So the state has their own kind of terms that are important for users to understand, like what data is shared versus not shared. And that is provided and linked through the online system as people are filling it out so that they can ultimately agree to it or not. We have found that this can be, especially for more sensitive pieces of information like race or ethnicity, it's not enough to just have like one global statement at the end. There actually can be points along the application where it's helpful to just specify why specific pieces of information are being collected and what's happening with that data. Same about immigration data. And so there are, for particularly sensitive pieces of information, we recommend actually adding in just tailored statements to those areas of the application or renewals so that people are clear when they're filling it out, why it's being asked of them, and if it's optional or not, and making sure that that's very clear to them. I'm not sure if that answered the question, but I hope that it did.
Great. We have another question that's asking about suggestions for like messaging around the public health emergency ending. I'm not sure if you all have started work in that area too much. It's towards the end by Steve Goldman, asking, saying that the Oklahoma Medicaid agency is promoting use of, language like public health emergency, be prepared for when Medicaid benefits end, as though the emergency is that benefits end for everyone. So it could be a little bit confusing. So I don't know if you have thoughts on that. I'm going to include in the chat a link to some research that CMS actually did that looked through some of messages that would be more or less effective around specific to the PHE ending, and how people can communicate to enrollees, but just wanted to see if you had any thoughts there.
Yeah, we have not done any specific work on the notices related to the public health emergency yet, but Gabby and Kristen, would you have anything specific to share there? Other than user testing it just to get feedback from folks?
One thing that comes to mind is when we've been testing denial letters or like letters that tend to have pretty negative messages, is that clients will find hope no matter what it says if there's like next steps that are listed or other resources that they can take advantage of. So instead of just giving like your benefits are ending, goodbye, there is like, hey, this is happening. Here's some other things that you can do once this is over. It just helps the message be received a little bit better and more differently. And again, it gives the client hope, saying there's something else I can do to help myself.
Right. Or like, here's where you can go for help, making sure they know who they can contact if they need help.
Yeah.
with
Even
their
if it's like outside of the agency, it might be community organizations or somewhere else
Right.
that you can look. Yeah, it's a great point, Kristen.
Awesome. And then the last question we have in the chat is around any suggestions for good translation services.
We don't have any specific ones to recommend. The states that we work with have kind of contracts through translation services that they use, but I think, Gabby, our recommendation would just be take those as a baseline and make sure to user test what comes from them, because even with decent translation services, we found a lot of opportunities to improve what's being translated based on feedback from folks. Would you have anything else, Gabby, to add to that?
No.
Don't use Google Translate.
Yes, don't use Google Translate. Yeah, I think it does provide a good baseline. Like if there's, like trying to test with native speakers, or even if they're not professional translators, but having them like go through it for you and provide some feedback might actually just help you point in the right direction of like what is missing and who you might need to be looking to work with. Yeah.
I guess one other thing that comes to mind, Gabby, is in addition to the service itself, asking questions about who specifically is translating and what is the native language that they're translating from, because we found like Spanish is a good example that you brought up, Gabby, but I was remembering with the application and renewals that the native language actually that was being translated was actually not the most relevant sometimes for the population in Michigan at times, and we had to push on that a bit. Yeah.
Awesome. Well, thank you so much. It looks like we're at time, so we can go ahead and close, but thank you so much to the team at Sevilla. This has been such an incredibly valuable presentation and lots of good information that I think advocates will definitely be able to use in their advocacy. And thank you to everyone who joined us today. We'll be sending out a recording of the presentation and slides from today after today's presentation concludes. And with that, we can go ahead and close. Thank you so much for joining, and I hope you all have a great day.
Thank you all.
Thanks, everyone.
Everybody.
Bye.